Welcome back to Health Matters, proudly brought to you by Cipla. I'm your host, Ryan O'Connor, and we welcome you to another incredible chat around the Health Matters South Africa. Joined again by the phenomenal Dr. Zenda, widely known as Dr. Gynae, Johannesburg-based OB-Gynae, sexologist, founder of We See You. As a fellow of the European Committee of Sexual Medicine, Dr. Zenda continues to lead transformative conversations around women's reproductive and sexual health across Southern Africa. Doctor, lovely having you back, because in this episode, we're unpacking a topic that affects millions of women, but often goes undiscussed. Fibroids, ovarian cysts, uterine conditions. We'll explore how these are diagnosed, treated, the options available, and most importantly, when you should worry. From painful periods to unexplained bloating or heavy bleeding, understanding what's normal and what's not can empower women to take control of their reproductive health. So, Dr. Zenda, lovely having you back. Let's start at the very beginning. What are fibroid cysts and other common uterine conditions, and how do they differ?
Right. Fibroids, let's start with the fibroids, what we also refer to as leiomyomas or myomas, are muscular. We call them benign because most of the time they're non-cancerous, and they're muscular structures that basically grow in and around the womb. They're more common in African women. 1 in 4 African women will have fibroids, and of those, 50% will be either symptomatic or non-symptomatic. And again, because the nature of them is that they are not non-cancerous, when they are asymptomatic generally and they're not causing any problems, we can leave them alone. But it's when they are causing problems. One of the biggest concerns in particular with fibroids is heavy bleeding, heavy menstrual bleeding. And I think this is where it becomes important for women to understand, firstly, what is normal. Anything more than 7 days is too much. Also, if you're having to change your pad or your sanitary product, whatever it is, within the first 2 hours of change, and then you have to change again, then you're bleeding a little bit faster. We shouldn't be bleeding more than 80 mils in total of the whole period, no matter how long your cycle is. When we're thinking about cysts now, I think also what becomes important as a distinguishing factor is where the fibroids grow. So predominantly fibroids will be, as I said, in and around the actual musculature of the uterus, whether they are inside what we call submucosal, whether they are subserosal, which is more on the outside, or whether they are hanging out, which is what we call pedunculated. Whereas when we're talking about cysts are generally, well, they form in and around the actual ovaries. And I always say, when I'm explaining the difference between a cyst and a fibroid, for example, a fibroid is more like a peeled raw potato. It's solid, it's hard, it's a musculature structure. Whereas a cyst, imagine a balloon that's filled with water. Now, cysts can differ in terms of their causes. Women in their reproductive phase, because of the hormonal cycling, the cycling of our hormones, we may get what we call the name flies away from me, a functional cyst, which is basically a simple cyst, or functional or simple cyst, which is basically as a result of a hormonal factor. But even simple cysts can become problematic in the sense that if they're too big, they may twist on themselves and they can cause pain. So we generally will have a rule of thumbs in terms of how we manage them. We can manage them conservatively if they're not causing too much issues. But as soon as it is affecting the quality of life of a client, then we have to then discuss the options of should we rather than remove it. Then you get other conditions which are not necessarily as visible. So fibroid cysts, we can tell, or we can have a look and see them on an ultrasound. So any general gynae visit, you should be able to, that forms a part of your examination, and you can spot those. Something that is often missed a lot is endometriosis, for example. It's another common gynecological condition, which is basically the big sign with it is menstrual pain that is not relieved on simple what we call analgesia or painkillers. And very often the pain may begin before the period starts, during, and goes on into even after the the period itself. What also you may find, especially the slightly older women, more in the sexually active, you'll find that they may experience a lot of sexual intimacy pain. To a point where they literally avoid being intimate because of the amount of pain. Endometriosis is very much related to hereditary. We still don't know for sure exactly what causes it, but there are a couple of theories. For example, part of the endometrial lining tracks back and ends up depositing in other parts inside the stomach that are not the endometriosis. But when you do get that release of what we call a prostaglandin, which is the chemical that stimulates the uterus to contract to release the lining, so that that's actually what your period is in essential fact. But now if these parts of the endometrium are planted everywhere else, all those areas are also contracting, which is basically what gives this excruciating pains. And then I would probably say polycystic ovarian is another one that is really diagnosed. And I know we've covered it as a topic in part of the hormonal and stuff. So those are generally sort of like the common ones that we see. Over and above, I would say, sort of like the second layer. The first layer will always be things like the sexually transmitted infections, the gynae infections like yeast, as well as bacterial vaginosis. Those are the common conditions that we see in gynecology and in the practice.
Now, you talk about these varying conditions. How are they diagnosed? Is it is it a clinical procedure? I mean, how are they diagnosed?
Yes. So, as I said, fibroids can either be symptomatic or non-symptomatic. And remember, women don't come to see a gynae only because something is wrong. Yes, that's generally sometimes the reason they will come through, because something is not going right. A period is too painful, they're bleeding too much, and that would prompt us then to investigate. But fibroids are very often actually diagnosed incidentally. A woman was coming for their general checkup, and as we do the scan as part of the assessment, we can see it on either a transvaginal or even an abdominal ultrasound. Same with the cysts. Cysts we can also pick up on ultrasound. Something that is a bit more difficult, endometriosis. Endometriosis is diagnosed, one, on the basis of the history of the pain, but also the most definitive way that we can diagnose endometriosis is actually by doing a laparoscopic examination where we put in cameras and we actually see. This can take a dual effect in the sense that we can diagnose and treat at the same time, because you can see the endometrial lesions that can then be ablated. What was the other one? Things like, for example, STIs. Generally, they are prompted by a symptom that we then treat. The bacterial sexually transmitted infections are the treatable ones that we can use antibiotics. Unfortunately, the viral ones, they're not treatable. So things like HIV, things like HPV, unfortunately, HIV stays in your blood system, and we can't treat it as up until this far. I know that there are very good studies and hopes in terms of that. In terms of the the gynae infections, yeast infection, and this is something that is a very common mistake because it's a common condition. A lot of and you get a lot of over-the-counter medication for yeast infections or bacterial vaginosis. You'll find people self-treating a lot before they actually go and see a healthcare professional. What often is the mistake is that you've got two organisms that naturally live there, and when the good bacteria is very low, then you're likely to get what we call a bacterial vaginosis, which is a bacterial side of things. If you use a yeast treatment for that, you've completely missed. If you use antibiotics, for example, for a yeast infection, you actually exacerbate it, in that it might seemingly be better for a short period, but it will flare up again because you've also destroyed the good bacteria whilst you're using antibiotics. So it's always important, even if it's something you think it's relatively small, you can get over the counter, just consult with your healthcare provider to make sure that you actually are treating the right thing. I think this also just, I know we hadn't really quite gotten to the treatment side of things, maybe to the point of self-treating. You often get a lot of misinformation about, doing things like steaming, or yoni steaming, or, I am never against what we call integrative medicine. And, we're not here to strip people of their belief systems as well in how they see health and how they see healing. But also sometimes what happens is when we waste time and not go and get diagnosed properly, these things can last and get to a point where, for example, if fibroids get too big, they risk a woman actually losing their uterus or even their lives. And most certainly it jeopardizes their chances of falling pregnant, if they still have hopes of falling pregnant. So yeah.
Doctor, you've covered even in this conversation so far various symptoms that women should look out for. You mentioned about menstrual cycles lasting, or certainly the bleeding lasting longer than it should. When is it time to say, right, I need to see a doctor?
Right. I would say always first, when you understand the natural or your own rhythm of your cycle, as soon as things are looking like they've gone off tangent, even if you're not necessarily experiencing pain, heavy bleeding, or so on. And this is where we kind of create different filters or different catchments to make sure that, we don't misdiagnose or we don't miss diagnosing somebody and only getting to it late. So first line is just make sure that you're attending your screening. Second line is when things go off sync, the usual, even if you're not necessarily in pain or bleeding, please go see your healthcare provider. And most certainly when things are consistent for longer than 3 months, a period that is irregular for longer than 3 months, period menses or period pains that are not relieved by a simple analgesia, particularly if it's happening on consecutive cycles, please don't wait. Go and see a healthcare provider. If something even in your, sometimes also it's a sense of not feeling well, but not quite knowing. I'm not sure what exactly it is. With things like bacterial vaginosis and yeast infections, often there's a discomfort around the vaginal area, discomfort and itchiness, or feeling a bit raw, or pain during intimacy. All those are the things that should make you think, this is not okay. I need to go and see my healthcare provider.
Doctor, how do these conditions, and you, again, it's something that we briefly touched on, but clearly these conditions do affect, in some instances, fertility and pregnancy?
Yes, absolutely. So when you look at fibroids, especially the more fibroids you have, so if you've got multiple fibroids or you've got big fibroids, they do feed on the blood supply of the uterus. So on the one hand, fibroids, generally, you'll find that a woman may still be likely to fall pregnant, but they are more at risk of an early miscarriage because one, they are taking the blood supply where it should be nourishing the fetus, but also secondly, they are taking up space, and so also may cause, even if the pregnancy continues, it may cause obstetric complications like forced to have a cesarean section instead of being able to deliver naturally because of where the fibroid is situated, or even something like a preterm delivery because of it taking up space. So those are some of the obstetrics which may not necessarily be quantified as a mortality, so to speak, but definitely do have an impact in the quality of life, whether it's for the mom or the fetus they are carrying. Cysts, predominantly, they cause a sharp acute pain, and that's because of the torsion. When they twist around each other, the blood supply is cut off. That's what causes the pain. And very often you'll see these patients will come in much quicker and more on an acute basis rather than something that's been there for a long time or for a while. And then for something like endometriosis, again, endometriosis is the one that is often, because in our societies, perhaps we've sort of normalized the idea of, yeah, it's normal to have pain during menstruation. It's normal to bleed a lot. I think the narrative should change a little bit into it is common to have pain during menstrual period, but it is not normal. And more so, if that pain is not relieved by an analgesia, and it disrupts your quality of life. You'll find, for example, teen girls not being able to go to school because of this. Women are unable to, attend to their daily happenings because of this. This is not okay. And again, like I said, to diagnose endometriosis definitively, we still would need that laparoscopic exploration. But certainly from the history that we get, we can definitely diagnose these.
Can lifestyle factors like diet, stress, even alcohol for those that consume it, or maybe even hormones make symptoms
Yeah.
worse?
Yeah, absolutely, yes. And this is why we always look at it from a holistic perspective. For example, obesity is a risk factor for so many gynecological conditions. Fibroids, yes. Cysts, particularly if they are related to polycystic ovarian syndrome, yes, they may cause that. Cancers, whether it's breast, whether it's ovarian cancer, those are some of the risk factors. So our lifestyle makes a big difference. You mentioned another one, things like stress. And we see this so often. A woman is built in such a cyclical manner that you shouldn't be on stress mode from first of the month all the way to the next of the month to the end of the year, start a new year. It's like our bodies are never getting that pause anymore. And this reflects in things like, difficulties with things like conception, even things that are seemingly, petty, like nails and hair growth, because it impact our whole hormonal system. And so it can never be something that is discounted in terms of lifestyle. So it is stress, it is managing stress, it's managing your diet, but also just making sure that you keep your body moving. For women in particular, especially the more you get into your 35s and above, you start to lose that estrogen. Which means you start to lose your muscle mass as well. And that's why we also then start getting those metabolic related lifestyle conditions like the diabetes, metabolic syndromes, hypertension,
Mm.
coronary heart disease, and things and the likes. This is because we start to then develop the fat around our stomach, which is the more dangerous kind of weight gain. And if we are not building up our muscle strength, bone structure, and bone strength when it really matters the most. This is why at a later stage we struggle. And now juxtapose this with the fact that already a lot of women are having children a little bit later, which means by the time, somebody's like, I'm ready to have a child, I'm 38 and stuff. If you haven't been looking after your lifestyle, you find that people already start off in the negative in terms of risk factors for a lot of these conditions.
When should women worry, doctor? When is monitoring enough?
I always say make your gynae your best friend, because very often, also because of the nature of gynecological conditions, it's that thing where you're like, oh, do I really have to go? Do I really, really have to go? It's private, it's sacred, it's sensitive. And so there's also that apprehensiveness, which kind of adds a layer why sometimes women don't go. The other thing is access. Not everybody has, access to a gynae. And this is why it's important to also explain that you can go to a clinic where they do women's wellness, because like I said, it doesn't only have to be at a time where things are not going wrong. So first and foremost, let's take the monitoring off your hands and say, go for your yearly checkups. Once a year, go see your healthcare provider for your women wellness checkup. That's the first one. The second one is obviously, as I've said, if things deviate from what you are used to in terms of your own rhythm and cycle, particularly when it comes to things like periods, in terms of how you feel, in terms of energy, in terms of even, you'll find people complaining about, oh, I'm feeling a lot more pressure than I used to. Meanwhile, and they may not have all the symptoms, for example, fibroids. They may not necessarily have a heavy flow, but they feel a pressure, or they feel even sometimes a backache, only to find that actually there is a fibroid that's causing pressure. Sometimes, especially the bigger they are, I mean, they can be as big as up to above the umbilical, the belly button, and this can cause pressure in the structures that are in front, which is the bladder, and the structures at the back, which is the rectum. So things like constipation, things like not being able to hold your urine for long because you don't have bladder capacity because of that pressure. So it's all these things. Whenever anything deviates away from your normal, please go see a healthcare provider. With things like pain and bleeding, I even say don't wait for 7 days. If you're saying a normal period lasts for up to 7 days, if you are bleeding out in the first 2 days, don't wait. And I think it's also advocating that your instinct about your own body is valid. when you don't feel right, and even if you go to a clinician and you find that they are dismissive, or you're not quite in agreement with the treatment proposal. Sometimes I've heard patients say, "Oh no, the doctor said we must go straight to theater," and I just didn't feel right about it. Those are things that are anything that you don't feel right about. Please go get a second opinion, find a different gynae. It's so important that, in as much as, yes, it is the clinician that kind of guides the treatment plan or guides the consultation, you are still in control. It's your body, it's your health. Yeah.
Oh, this has been another incredible and insightful chat with you, Doc. Thank you so much for joining everybody. Another episode of Health Matters, proudly brought to you by Cipla. Dr. Zenda, thank you so much for your time once again.
Always such a pleasure. Thank you so much for having me.
Thanks. Now, don't forget, everybody, subscribe to our YouTube channel, Health Matters SA, for more episodes and conversations to empower you to take charge of your health. And until next time, stay informed, listen to your body. Remember, your health matters. And of course, your reproductive well-being is worth prioritizing. See you again soon.